Assalamu alaikum dear students, it's Dr. Masma Mehta. Welcome to my YouTube channel Medical School. So today we are going to learn about renal cell carcinoma and lower urinary tract carcinoma. Let's go. Renal cell carcinoma. Now this is the malignant epithelial tumor arising from kidney tubules. Now how it does look like. So we are actually focusing on the appearance. So first we have to talk about the gross appearance. So it's yellow mass that is mostly at the upper pole of kidney. And histologically, it is classified as the clear cell carcinoma, papillary cell carcinoma, chromophobe carcinoma, and collecting duct carcinoma. So let's start with the clear cell carcinoma. So this is the most common type of renal carcinoma that occurs. And histologically, you will see clear cells, you will see abundant cytoplasm, which is actually loaded with granules of glycogen and lipids. So here you can see this is the thin, delicate septa, which contains the wall. So these blood vessels are present here. Okay, then you can see here polygonal cells are another characteristic feature of this clear cell carcinoma, and the nucleus is present in the center and it is loaded with the cytoplasm is loaded with the granules and lipids. Okay, then we have papillary cell carcinoma. Now it occurs at the epithelial lining of distal convoluted tubules. Now it usually occurs due to dialysis associated cystic disease. Now remember that whenever the patient is on dialysis and he or she is using that is treating herself with the help of dialysis, what actually happens and chronically, so what happens, there can be cyst formation within the kidney. Now this cystic disease in turn can lead to chronic kidney failure that may lead to the papillary carcinoma. So histologically, you will see here cuboidal cells with the scanty cytoplasm, which is actually highly vascularized. So these are the blood vessels here. You can see these are the cube-like cells here, and this is the histological appearance of papillary cell carcinoma. Okay, then you have chromophobe type. Now it arises from the intercalated cells of the collecting duct. Histologically, you will see eosinophilic cytoplasm and halo around the nucleus. So this is eosinophilic cytoplasm and these are the halos around the nucleus. So this is the histological appearance of chromophobe type. Okay, then we have collecting duct carcinoma. It arises from the epithelia of the collecting duct in the medulla. Now, histologically, they are irregular channels. These are lined by highly atypical epithelium with hobnail pattern. Now, what is hobnail pattern? So, it is actually the small or the medium-sized cells whose nucleus is located on the apex. So, this is called as the hobnail pattern. So, what are the causes of this renal cell carcinoma? So, it has genetically caused and then we have the acquired causes. So initially, we should talk about the genetic causes. So, it can be sporadic, it can be familial. Now, pathogenesis includes mutation in VHL tumor suppressor gene. So, whenever there is mutation in tumor suppressor VHL tumor suppressor gene, that can lead to abnormal growth. How? By secreting insulin growth factor 1 and hypoxia induced factor, that is a transcription factor that results in increasing abnormal growth. Now come to the risk factors for acquired causes. So continuous and chronic use of tobacco, then hypertension, obesity, estrogen therapy, heavy metals and petroleum product. These are the risk factors for the acquired renal cell carcinoma. So come to another tumor that is basically renal tumor. So this is a renal malignant tumor that arises in children. Now this occurs due to loss of WT1, which is another tumor suppressor gene. Now it develops in very early age of a child, early as 3 years. So this WILM tumor is because of the point mutation or mutation of WT1 tumor suppressor gene. If this tumor suppressor gene is not working, there will be tumor that is called as WILM tumor in children. So let's talk about the metastasis. So the metastasis of renal cell carcinoma usually occurs mostly in lungs. So it's about 50% of the cases that the renal cell carcinoma metastasize to the lungs, and then 20% to the bones, and then lymph nodes, and then liver and adrenal glands. Now, what are the clinical presentations? So the patient will be presented with the triad. So there will be flank pain, there will be hematuria, there will be abdominal mass. But remember, this is the more prone sign of this condition. So hematuria is a basic diagnostic feature here. And then the patient may have the paraneoplastic syndromes. Now, the paraneoplastic syndrome is a group of rare disorders occur when immune system reacts to the cancerous cell. So, against the cancerous cells, how your body responses that actually causes the paraneoplastic syndrome. So there will be polycythemia, there will be hypertension, hypercalcemia, amyloidosis, Cushing syndrome. So these are the paraneoplastic syndrome. Now let's talk about the lower urinary tract carcinoma. So we have three types here. We have urothelial cell carcinoma, squamous cell carcinoma, and adenocarcinoma. Starting with the urothelial cell carcinoma, it's a malignant tumor arising from the epithelial lining of the renal, pelvis, ureter, bladder, and urethra. Okay. Now, recalling the epithelia of the urinary tract is transitional epithelia, right? So, this transitional epithelia, there is a mutation within that, and that results in the malignant tumor. But that can include the renal, pelvis, ureter, bladder, urethra. But the most commonly it occurs in the bladder. Remember that most commonly this occurs in the bladder. Now, it is generally seen in the older patients. Morphologically, we have two types of malignant growth. So here can be flat, here can be papillary growth. So here you can see we have here papillary growth. This is the finger-like projections of the mostly in the bladder. Here you can see this is the bladder wall and containing connective tissue, muscle, and fatty layer. Here is the transitional epithelium that has undergone malignancy. So here's a papillary tumor and that is a flayed tumor. Now the flayed tumor mostly arises due to the mutation in P53 tumor suppressor gene. Now adenocarcinoma, that is a malignant proliferation of glands of urinary tract. If there is abnormal proliferation of glands, it can cause adenocarcinoma. And then the third most condition we have is squamous cell carcinoma. Now, think for a while, if I'm saying that the urinary tract contains the transitional epithelium, then why I'm talking about the squamous cell carcinoma here? That is just because when there's chronic conditions like we have chronic cystitis, what happens? There is metaplasia of the bladder. That condition also mostly occurs in the bladder. So there is metaplasia. Just for compensatory process, what happens? This transitional epithelia converts into squamous cell epithelia, and then what happens? There is cancer developed within the bladder. This is just because if the patient is not treating uh, herself or himself, then this squamous cell carcinoma can occur. So it is a malignant proliferation of squamous epithelia of bladder, and the causes are long-standing chronic cystitis. As I have told you, long-standing nephrolithiasis. Now this term is used for the kidney stones. And then we have schistosoma hematobium. Now this is the parasite which is actually entrapped within the bladder and causes the cancer. Okay, so this is the squamous cell carcinoma. Initially, it was transitional, but what happens due to certain diseases like chronic conditions, there's a metaplasia of the transitional epithelia, and squamous cell carcinoma occurs, develops, and then the cancer develops. So that was all about the renal cell carcinoma and lower urinary tract carcinoma. I hope I was so clear and you understood very well. So thank you so much. Allah Hafiz.